My name is Kelly Anderson, and this presentation is for school education programs and their direct relation to child wellness. Our cultural backgrounds play a vital role in our idea of what wellness is. Another crucial element is social wellness, which speaks to our views on what wellness means to each of us. The social and cultural influence was a movement that began in the 1950s and 1960s, but is still very much part of our everyday lives. The female image is a subject that has been reviewed in this course and is one that has shaped our sense of wellness. Some view the ideal image of wellness as a thin, young female, when in fact she may very well be unhealthy, because young and thin does not always equal healthy. The American society has changed their view of wellness, and it has become more of a push for personal and societal change. As a healthcare administrator, wellness is critical in my discipline of study. Health and nutrition mainly make up the healthcare industry. Interdisciplinary approaches to wellness include advances in science and technology. They improve societal and environmental welfare through the creation of wearable devices and sensors. Additionally, employers offer benefit packages that encourage weight loss and chronic disease management. Company insurance provider programs, along with technology, have had a significant influence on decreasing costs while promoting wellness. The origin of the issue is for decades, childhood obesity has been a healthcare crisis that has plagued the U.S. If significant changes are not made within our communities and to school nutrition and physical education programs, the cost will not just be financial, but the health and wellness of our children. Childhood obesity has more than doubled in children and quadrupled in adolescents in the past 30 years. At this point, you may be asking yourself, what is this issue about? Well, I will tell you. It is about poor nutrition and decreased physical activity in schools, and they're adding a heavy burden to childhood health and wellness. By implementing improved nutritional and physical education programs back into the school curriculum, we will be protecting future generations of American children from a life of chronic disease. Additionally, improvements in nutritional and physical education will contribute overall to improved health and wellness. The target population is that of the percentage of children between 6 and 11 years of age in the United States who are obese, and this has increased from 7% in 1980 to nearly 18% in 2012. Similarly, the percentage of adolescents aged 12 to 19 years who were obese increased from 5% to nearly 21% over the same period. As the above referenced numbers clearly express, there is a great need for change, and it starts with our children and young adults. Research has shown that regular access to better nutrition, starting with breakfast, coupled with increased opportunities for physical activity, may help students reach their potential throughout the school year, which may lead to better performance at testing time and beyond. Childhood obesity has been a healthcare crisis that has plagued the U.S. for decades. Chronic disease associated with childhood obesity leads to chronic diseases in adult and poor overall health. By increasing physical activity and incorporating a healthy diet, the result will be a trifecta win: weight loss, chronic disease management, and improved academic performance. The benefits of regular exercise include improved concentration, memory, and classroom behavior. Poor nutrition impedes behavioral and cognitive development, educational and reproductive health, thereby determining or undermining future work productivity. Reducing obesity will help lower healthcare costs through decreased office visit and prescription drug refills associated with obesity. Improving school nutrition, incorporating nutritional education, and adding physical activity back into the curricula are steps in the right direction to lower healthcare costs and improve patient health. Significant changes to school lunch and physical activity programs will improve the quality of school nutrition. Incorporating nutritional education programs and adding physical activity back in to the school curriculum. By implementing these changes, we will be protecting future generations of American children from a life of chronic disease. Implementing a physical education and nutritional curriculum to every U.S. school, all children, regardless of their socioeconomic standing, would receive a physical and nutritional education. The new physical education curriculum would focus on moderate to vigorous activities, which keep students moving 50% of the time that they are in class. My prediction is that if significant changes are not made to the nutritional and physical education programs within our schools, America will continue to see a decline in the health of our children. Legislative changes need to be made in regards to the types of food being served to children at school. A joint venture with local and state governments would help with funding and speed up the process by implementing these new programs. In addition to joint ventures and legislative changes, fundraising must begin immediately, and a budgetary committee must be established to assist with allocation and disbursement of funds. In the meantime, all unhealthy meal options should be removed from the school menus. In closing, crucial changes must be made to school nutritional and physical education programs. Improving nutrition and physical education programs in school will decrease childhood obesity, reduce the number of children suffering from chronic disease, and improve academic success. An increase in the overall health of all children will be seen because, in conjunction with receiving high-quality meals, low-income children will receive meals that they may not have otherwise. Moreover, and lastly, nutritional and physical education programs will improve financial strain on America by reducing the number of children suffering from chronic disease.